Welcome to Gift of Health Total Tuesday Wellness, and we are so excited you guys are here. So let us know if you are able to see us, hear us. So just gives up a thumbs up so we just know that you're able to see us and hear us. And I'm so excited for today's session, and today's guest doesn't need much introduction because you all know him very well. So is there anybody here who is new or who hasn't met Dr. Matt Lederman? So let us know here. Okay, I know, like you all know him from our Forks Over Knives documentary. So for those of you who are meeting us for the first time, let me just give a brief introduction. So Dr. Matt Lederman, you all know him from this wonderful documentary, Forks Over Knives. But what you may not be aware is Dr. Lederman, he also completed his CNVC trainer certification, as he found nonviolent communication to be the foundation on which mind, body, and interpersonal healing lies. So he's particularly passionate about using technology and other creative outlets to bring nonviolent communication into this world, supporting individuals, families, and organizations. So he strongly believes that effective care must be trauma-informed and supports that intention through his continued work with the polyvagal theory and somatic awareness principles. So I'm really excited for today's session as Dr. Matt Lederman, he would be sharing about this and how this literally affects our health. He has always been ahead of his time. So, like many decades ago, he knew the importance of nutrition, and you saw his work in Forks Over Knives documentary. And today, he realizes the importance of this nonviolent communication, and it is such a huge honor and pleasure for us to be hearing from him today, because I know this is again going to blow away your minds. We are eager for this much awaited session. So without further ado, welcome Dr. Matt Lederman, and I'm so excited that you're here.
Thank you for having me. I'm glad you're so supportive of this information.
Thank you so much. So Dr. Lederman, like what actually, I would say, inspired you to even think about this nonviolent communication, or what even inspired you to go through this route?
So what inspired me was personal experience. I knew that connection and how you communicate was important. Just like 30 years ago, I knew diets, it matters, but I didn't realize how much diet mattered until I got into the plant-based diet work. And similarly around connection, I didn't realize how much connection matters until I got into it. And personally, I had a real bad problem with chronic back pain and sciatica. And I couldn't get it to improve. And it turns out that everything that I'm going to sort of talk about today, one of the big factors that are impacted by this is chronic pain. And there's other issues, but with people in the plant-based diet, chronic pain doesn't respond particularly well for some people to just changing your diet. And then there's other things like mental health, some gastrointestinal challenges, anxiety. There's things that just, don't respond, where if you just change your diet, it's not enough. Like the diabetes, the heart disease, that reverses pretty aggressively with diet. So not only is it nice just to change your connection, and how you connect, but it actually is important for a lot of physical health factors, including cancer, metastases, neurodegenerative disorders, your microbiome, inflammation, chronic inflammation. So your ability to fight viruses, right? All of that is actually affected by what we put under this header of connection.
That is so amazing to know. So, because as you said, we wonder, does connection really affect our health? So, so enlighten us today. I know like you have a beautiful presentation. So
Yeah, let me put that up.
yeah, feel free to share
All
that.
right, let me share that and I'll put it as a slideshow.
Yes, we are able to see this.
Perfect. So this is where I tell people that you want to unlock your full potential. I'm
Mhm.
not, diet is super important, but so is connection. It's not one or the other. Whereas a lot of people like to think, well, what's most important? It doesn't matter. There's no such thing as most. It's really everything. Everything has an impact. So this is something we implemented in our families. It's not only changed our health, it changed how we show up, how we relate to each other, and ultimately the joy that we feel in our family. So not only is it physical health, it's also emotional, spiritual, and mental health as well. So the goal for today is I want to show you what connection can do as far as your well-being, stress, immune function, gene expression to spiritual well-being. It's all affected, it's all impacted. And the science now is getting exciting to where we can start having some really good conversations about this. So I'm going to talk a lot about something called threat physiology, which is what your body does when it thinks it's not safe. And it does, I use the word think, but it's not really think. It's when it perceives the environment in such a way that it's not safe. So, for example, if you hear a loud noise, you don't have to think about it. Your body reacts to that. Sometimes, if it just scares you, all of a sudden your body tenses up. That's not something you think about. That just happens automatically, which is good because you don't want to have to think because it might be too late if you have to wait to think about it. So there's a lot of reactive responses. And that's what I'm talking about. What is your body perceiving from the environment, even subconsciously, not just what you're thinking about? There's a lot of people will say, hey, Matt, what are you talking about? I feel safe. And I'll say, you might feel safe, but are you giving your body messages of safety? So if you're, working back to back without breaks, if you're stressed and worried about money, if you're always stressed about, if you're deprived on your diet and miserable, or if, you're worried about expressing your feelings, if you're worried about expressing yourself to someone else because you're worried about their reaction, if you don't have meaning and purpose in your life, right? All of these things affect our physiology. That's what's exciting. So what causes a physical threat is what we're used to focusing on. If a tiger is going to come in your room, you're going to have that's a physical threat. But what we found is that emotional, spiritual, and mental threats affect your physiology the same way as a physical threat. And some of these areas where it impacts at the mitochondrial level. So within the cell, you have these things called cytokines that allow the cells to communicate with each other. You can have pro-inflammatory and anti-inflammatory cytokines. And depending on how your environment is perceived, you'll make more or less of each. Stress hormones, we all know about adrenaline, cortisol, oxytocin, vasopressin, all of that is impacted. Where blood flows, hold on, heart rate, breathing, muscle tension, digestion, your senses, right? All of that is changed based on how you're perceiving your environment. That to me is so exciting that your environment, minute by minute, is changing your body. Your body is not this static thing that's just sort of going through life. It's that no, there's a dance that it's having with the environment. Blood pressure, dry mouth was one of the things, immune response, blood sugar, libido, all of this, again, is affected by connection. So what does safety feel like? People say, well, okay, well, if I think I'm safe, how do I know if I'm safe? Well, if you have this sense of calm and curiosity and compassion, these are the 8 C's of safety: confidence, creativity, clarity, courage, connectedness. All of that are signs that you're probably in a physiological state of safety. So if someone says, I don't want to, I don't want to contribute to whatever you just asked me to do. Now, if you come back and you're like thinking, what a jerk, and oh my God, and I can't believe that person, and you're telling someone else about what's wrong with that person, right away, your body is treating that person like a perpetrator. You're a victim. You shift into threat physiology, not consciously, it's subconsciously. And believe me, there's no curiosity, right? But if you were curious, being like, oh, he doesn't want to help me with this thing, I wonder what's preventing him from saying yes. Now I'm going into a curious place. So that ability to do that is not only nice for the relationship, but it actually shifts your physiology and affects your physical health the more that you can do that. Here are some theories that could be their own talks that I think are really important to understand. But polyvagal theory, the cell danger response, and this something called the conserved transcriptional response to adversity. All three of these are different ways that our body relates to the environment. Polyvagal theory talks about, sort of on a macro scale, the autonomic nervous system, which has intervention of, talks about the vagus nerve, 80% of which the fibers are afferent, meaning they're taking in information. So it's basically scanning the environment, and then it's sending a message throughout the body saying we're safe or there's threat. And if there's threat, it's going to turn on and off certain things. So, for example, your gut needs messages from the vagus nerve saying we're safe for the gut to function properly. And when we're not safe, it says, okay, let's not worry about the gut. Let's focus on the physical threat. And then when the physical threat passes, okay, let's turn back on, say we can digest again. So the rest, digest, the reproduce, all of that is dependent upon how what information we're taking in from the environment, and do we experience that as safe or threatening. The cell danger response is similar, and it actually interacts with the vagus nerve and the autonomic nervous system, but it's at the cell level. And inside the cell, what happens to the mitochondria when they get messages from the world around them that we're not safe, whether it's a virus or somebody yelling at you, both of which affect at the cellular level and what the mitochondria do inside. And this conserved transcriptional response to adversity is what happens to gene expression of our immune cells. So gene expression of our immune cells is affected by how we perceive our environment. Your genes are not this static thing that's just there. It's not your destiny. Your genes are more of a menu from which life around you gets to order from. So if life around you is perceived as safe, you're going to turn on certain genes and off other genes. And think about this. If you have a threat in your environment, your immune system cells, which are your natural cancer fighters, are going to say, hey, we're not really worried about things like cancer and viruses. Viruses are something we worry about when we're around lots of people and we're social. But the threat is like, hey, I got to worry about myself. I'm not worried about getting stuff from other people like viruses. I'm worried about a tiger biting my arm, and then I'm going to get infection. So it now shifts from fighting viruses to focusing on bacterial infection. And it also says, I don't need the immune system to worry about cancer right now. I need the immune system to sort of turn on inflammation so that we can start repairing any tissue damage that happens from this fight with the tiger. So this response to adversity is basically saying, if we think there's adversity or impending doom, we're going to stop fighting cancer, stop fighting viruses. Instead, what we're going to do is we're going to be ready to fight bacteria, and we're going to turn on inflammation so that we're ready to heal any damaged tissue. And this is a balancing system that's happening. And anytime you perceive adversity, you turn yourself on towards dealing with the adversity. But the problem is people are experiencing adversity throughout their day all the time. And remember what I said, it's not just physical adversity, it's social, emotional, mental, spiritual. All of that affects the system similarly. So when people treat other people poorly and get into fights and arguments, it's not that we have to suppress our feelings, but if we can express them in a way that increases connection, we won't turn on these systems that are bad for our health when they're on chronically. They're great for our health if we actually got bit by a tiger. But how often is the adversity really a tiger about to bite us? So how do we turn on safety? How do we go from threat to safety? That's where we talk about this in our book, Wellness to Wonderful, where we have 9 pillars, starting with the self and connecting to yourself. What's going on inside of you? We want to regulate the nervous system, help your body understand that it's safe, that its needs will be met. And then we use the internal world. We optimize the internal world with sleep and nutrition, activity, and play, so that we can then optimize our connection, enhance our connection with our family and friends, at work, which includes meaning and purpose. In fact, the biggest impact on that conserved transcriptional response to adversity, the one that's pro-inflammatory and does not help you fight viruses as much. The number one impact on that, or the biggest impact, was lack of meaning and purpose in your life. So lack of meaning and purpose was the most pro-inflammatory thing from that perspective, at least, right? People don't think about that. So they're going to a job that they hate. They don't know why they're getting up in the morning, and they're worried about their diet, which I think is really important. But there's this other piece that's keeping them in a really terrible pro-inflammatory state that makes them susceptible to things like cancer and viruses. So don't just focus on your diet, focus on this as well. Spirituality, something that there's something bigger than yourself and the natural world, all the life on this planet. When we have all 9 of these pillars, when we're aware of them, they don't have to be in perfect balance. When we're aware of them and we're tending to them, we start to send those messages of safety to our body that, hey, you're safe. You do not need to turn on these systems to fight a tiger. And when these are out of whack, when we don't have play, when we're not active, when our nutrition's off, when we're not sleeping, all of a sudden we turn on that threat physiology. And what's really interesting is that they affect each other. So when you're disconnected at home or you're working and miserable, you don't sleep very well. Why don't we sleep well? A lot of people think they have sleep disorders. And I'll tell them, your body's doing exactly what it should be. If you're mobilized for a threat because of how you run your day, your body shouldn't sleep. If it thinks there's impending doom, why would it sleep? So what we have to do is we don't have to focus on getting you to sleep. We have to focus on helping your body believe that it's safe. How do we help your body believe that it's safe? We do this work together. And it's over time, because we didn't get out of whack overnight, and we won't get back into alignment overnight. But as soon as you're aware of this, it opens up this whole new area and toolbox for people. So healing requires safety physiology. Remember, you got to feel safe to do things like reducing chronic pain, improving mental health, improving recovery from disease, and overall lowering your disease risk. We got to get you feeling safe. I'm going to show you a little bit of data on the impacts of regulation of your nervous system and connection affecting your physical health. This is exciting because there's lots of opportunities to show. Remember, I talked about chronic pain? A lot of people think chronic pain is coming from the whatever's injured. But that's not how pain works. So if I break my hand or cut my hand, there's an impulse that goes through my arm, my nervous system, to my brain. My brain says, you know what? Let's cause some pain so that they keep that area protected. Because if you keep damaging a broken hand, let's say, it's not going to heal. So there's receptors in the hand, but they have to work with the nervous system, the brain, to actually cause pain. Pain is a danger signal that something is hurt or hurting and needs to be protected. So the pain is actually trying to help us. Now, when you have chronic pain, the problem is it's no longer coming from an impulse from tissue damage. It's coming from the nervous system and just shooting back out, down. It's an inappropriate trigger of that pain pathway. So instead of it having a stimulus here, it travels up to your head, your brain. Your brain says, oh yeah, there's a damaged area. Let's keep pain going until it heals. And it usually takes, let's say, 6 weeks for a broken bone to heal. And then it says, oh, we've healed. Now we can turn the pain signal off. But when you have chronic pain, it's not because of damage. It's not because of a broken bone. It's because your brain is sending out those pain signals inappropriately. So how do we turn off those pain signals? We have to help people reprocess their pain. There's actually something called pain reprocessing therapy. I'll show that in another study. But this was a great study here to show you that people would have something called reflex sympathetic dystrophy. And they looked at 28 patients where they have this. Anybody who's been diagnosed with this, it's terribly painful. And you'll have this pain in your hand, let's say, and you'll think that it's coming from your hand. So you'll say, my hand hurts, my hand hurts, my hand hurts. And what they did was the pain was so bad that they would amputate the hand because they said the hand hurt so bad. But what was interesting is that only 2 patients experienced pain relief after the amputating what was hurting them, what they thought was hurting them, while these symptoms recurred in the stump for many others. Does that make sense? So even though you think it's coming from your hand, if it was just coming from your hand and you cut it off, your hand wouldn't hurt anymore. But if it was coming from the brain saying that your hand hurts and that your hand should hurt, and you cut it off, cutting it off isn't going to affect it. That's what this study showed. This was looking at multiple sclerosis exacerbations when you have, for example, major life stressors and increased symptoms, stressful life events, financial and relationship stress, and the exacerbation of multiple sclerosis. Another one showing higher levels of stress and pro-inflammatory cytokines, again linked to multiple sclerosis exacerbations. So when people say, wow, you have multiple sclerosis or some other autoimmune disease, we don't know. A lot of the conventional system will put you on medication, hope for the best. It's sort of like this faith that things will be okay. But that's because we're missing this other piece. And that's where connection can be so helpful. Because again, what I'm talking about connection is this whole area that I'm talking about today is usually out of whack for these people. Here was a study looking at empathic doctors. And when it looked at the impact of empathic doctors on the physical health of patients. This was pretty interesting because it's showing the connection between the doctor affects the health of the patient. So how the doctor is affects the physical health of another person. And that's what's the beauty of connection, is that your health is not just about you. It's about how you relate to the people around you and how they relate to you. So this one was an empathic doctor, highly empathic doctors compared to low empathy doctors. When they looked at diabetic patients, they had 29% better blood sugar control and 25% more likely to have a low level of the bad cholesterol. The only difference in this study was a high empathy doctor versus a low empathy doctor. Here was a study of 21,000 diabetics, again, looking at high empathy doctors compared to low empathy doctors. The doctors that connected more to their patients had patients with 41% lower odds of acute metabolic complications, which is all the bad stuff that happens when you have diabetes, and we don't want them. So again, how the doctor was with the patient affected the patient's health. Here was one where you had 234 people having, when you put them in small groups, because they were feeling lonely, disconnected, isolated, put them in small groups focused on empowerment, peer support, enhanced social integration. They had improved survival. How cool is that? You hang out with a lot of people, your survival improves. But it's around connection. It's not just being next to people. That there's a lot of people I'll talk to. I work with couples. I do a lot of work around connection with couples. And you'll have these people that are together, but they're still very lonely. They're still isolated. In fact, they're hopeless. They feel hopeless. They feel helpless. They feel trapped. So it's not about being with people. It's about how you are with those people and how they are with you. The good news is, through using nonviolent communication, we can change that. So you're not just stuck, right? You can change how you are, and you can change how you relate to other people. This was about 1,500 patients looking at physician's empathy, and it was associated with pain intensity, fatigue, and back-related disability. Interesting, physician empathy was associated with more favorable outcomes than non-pharmacological treatments, opioid therapy, and lumbar spine surgery. Physician's empathy. I tell students all the time, I say the most important thing that you can do for your patients is let them know and have them believe that you care. And if you can just show up and care, you start the healing process and probably do more than a lot of the medications and procedures you offer could ever hope to do. This was a study looking at monkeys. And you took a monkey and you put them in a cage by themselves, and they looked at the monocytes, and you have this type of white blood cell that fights infection and helps with all sorts of things in the immune system. And you have something called warrior monocytes and repair monocytes. And they sort of change back and forth. Your body is constantly shifting the equilibrium based on what it thinks is going to help you survive the best. And if it thinks there's a fight or a threat, it's going to say, let's increase production towards warrior monocytes, which are like a bull in a china shop. So they fight the threat, but they cause all sorts of problems in the body. So if your body says, hey, that's okay, we're going to fight a threat, and then we'll go back to the repair and restore, if we never get back to the repair and restore, because we're always living our life like we're in threat mode, it's doing all this damage all the time. But interestingly, when you took these monkeys and put them isolated by themselves, their monocytes went from repair to and restore. They went to warrior monocytes, and they had a hard time going back to repair and restore. But when you put another monkey in the cage next to that monkey, the shift went back to its ability to go to repair and restore monocytes, and its ability to convert was more effective. So in other words, isolation affects cellular changes in our body that affect our physical health, including inflammation, ability to fight cancer and viruses and other invaders. So isolation is, to me, another culprit just as much as your bad diet. Lack of meaning and purpose is just as much a culprit as your bad diet. Now, it doesn't mean you just focus on one or the other. It means we got to do it all. This was one with chronic back pain. These people had back pain on average for 9 years. And they randomized them. They said, okay, let's put them into, they have one physician session plus 8 sessions with a special psychologist that focused on this pain. PRT is pain reprocessing therapy. And these are people with chronic pain. Remember, the pain that is not coming from tissue damage. And we have to help them reprocess how they perceive pain, that they're safe. There's nothing broken in their body. There's no damage. And then how do we help you feel safe and your body to regulate? And if we do that, what we found was that 2/3 of the intervention group went from having this terrible pain to almost to no pain or nearly pain-free. And they sustained that for 12 months. It was 3 times as effective as placebo, 6 times as effective as conventional care. All they did was pain reprocessing therapy over 4 weeks, 8 sessions. And you took something that was causing them such pain for 8 or 9 years, and they fixed it in a month. Why? Because they actually addressed the cause. This study looked at trust and the impact of trust on your perception of pain. If you had a doctor that gave you a painful stimulus and you had low trust with that doctor, compared to another doctor that had high trust, and they gave you the same stimulus, patients with low trust felt more pain. So if you don't trust your doctor, or you don't have trust, which is what this is really getting at, lack of trust, you can understand why that turns on threat physiology. Threat physiology increases your sensitivity to pain, right? You want to be hypersensitive and aware of your environment when you think there's a threat. So if we can feel trust, we can feel safe. When we feel safe, we don't feel pain to the same level. In fact, these low trust people not only had more perception of pain subjectively, but in an fMRI of their brain, they lit up the pain centers more. There was effective connection on microbiome. So suppressing emotions. When you suppress emotions, you tell your body, you give a message that these are not safe to share. You got to keep these hidden. If you have to keep something hidden, it's dangerous. Danger turns on threat physiology. So when you suppress emotions, what did they find here? When women who reported being happier, more hopeful, and better emotional management skills resulted in less harmful bacteria and more health-promoting bacteria. Here was one, remember the CTRA I talked about, which is, think of CTRA as increasing inflammation, decreasing your ability to fight viruses and cancer. So you don't want the CTRA to go up. It's a type of gene expression. When you randomize people to perform kind acts for others, they had a reduction in that CTRA, that inflammation and the negative impact on cancer and viral fighting. Here was one, the impact on pro-inflammatory gene expression. If there was higher emotional intensity, basically it's a nice way of saying yelling at each other. If this couple was yelling at each other, the person yelling had increased pro-inflammatory gene expression, both 30 to 40 minutes after the event and 80 to 90 minutes after the event. So in other words, an hour and a half later after you're in a fight, you're still having increased inflammation. What's also important is that the listener, 80 to 90 minutes after, had increased inflammation as well. So not only does it impact the person that's yelling or having higher emotional intensity, you also have the person that's receiving that intensity their immune system is affected because we're affecting each other. That's what I'm trying to get across. Whether we connect with each other or disconnect from each other, we affect each other's health. This was one, expressive writing. Expressive writing is basically writing about your deep, dark secrets that you are ashamed to share and that we are told to keep to ourselves. And you'd write them down, you can throw them out, doesn't matter. But there's something about writing them out of paper that tells our body that we're not suppressing them anymore. And when you don't suppress them anymore, they're not dangerous anymore. So we sort of tell our body that you're safe by allowing you to write about emotionally charged, suppressed experiences and feelings and thoughts. And when you compare that to a control group, which is just told to write about, trivial tasks during the day, you see these improvements in people that do expressive writing. This one improved lung function by 14% for 12 months in people with asthma. This one looked at fatigue and pain levels with expressive writing on rheumatoid arthritis and lupus. This one looked at fibromyalgia. There were significant reductions in pain and fatigue and better psychological well-being with expressive writing. Here's one looking at a 30% reduction in pain severity with fibromyalgia. Here's one with, and they had better physical functioning and reduced tenderness. Here was one on HIV viral load, CD4 counts. All that was improving with expressive writing. Here was one with expressive writing on wound healing and that your wounds healed better. Here was one on blood pressure improving with expressive writing. So the power of connection is that it helps you feel safe. How do we do that? What do I mean when I say connection? Because I hopefully have hit home that this is not just a nice to have. This is important to do for your physical health. When you change the way you talk and think about other people, it's not just nice for them, it changes your physical health. So for example, if you hate one of the presidential candidates, if you can learn how to transform that into using nonviolent communication, you affect your physical health. Because depending on who you like, let's assume you don't like Trump. If you imagine Trump becoming president, your whole body will tighten. And you are shifting your physiology when that happens. That's actually a sign that your physiology is shifting. So pro-social interactions influence not just stress reduction, but a wide range of health outcomes. It's beyond the benefits, not instead of, beyond the benefits of nutrition, sleep, and exercise. And what I'm going to do is teach you something called the connection dance. I'm going to give you the tools for that. But we're going to eliminate artificial harmony so you can express yourself authentically. And you're going to have stronger relationships and emotional resilience. So for example, when people are triggered by anger, if you learn nonviolent communication, instead of trying to get other people to stop being so angry, you learn how to empathize with anger so that you're impervious to it. When you empathize, when someone's in the most pain, they're usually communicating in a way that makes it least likely for them to get connection. So you can give them a gift and yourself a gift by empathizing with what's going on inside of them that's causing their anger. Same thing with artificial harmony. That's when you suppress to try and maintain harmony. So you suppress your needs and feelings to try and keep harmony in the group. But when you do that, you're telling yourself that your needs don't matter. Your feelings are dangerous to share. Keep them to yourself. We want compassionate authenticity. That's what we're shooting for. So how do we do this? This is all about nonviolent communication. And when we parent, Alona and I, my wife and partner, have a podcast that's called We Be Parents. And it's all about bringing nonviolent communication into the home. If you can teach this early and get your children on board, it really makes a big difference just in the energy of the home. And we call our style of parenting collaborative, non-permissive parenting, where we're going to collaborate where everybody's needs matter. We are not going to go to the other side of permissive, meaning that I'm not going to meet your needs at the expense of mine, but we're going to try and care about everybody's needs. So the big difference between nonviolent communication and sort of how a lot of people relate is that we have been taught to be good kids, good students, good workers, good partners. So we don't connect to what's going on inside of us. We focus on what's expected outside of us. And then we let that drive us. Good is based on what others, not us, define it to be. That's problematic. We want our intrinsic values to motivate our behavior. not to try to focus on what will make other people happy. We want to care about other people's needs. So it's not about not being caring, but we're driven by our internal values. That is the goal. And then when we express what we don't like, we express it from what's going on inside of us, not what's wrong with the other person. Right? A lot of times if I'm hearing more words than I like from somebody, I'm going to express that by saying, you talk too much. That's not helpful. That's not connecting. I want to talk about, hey, I'm feeling a little frustrated because I want to participate in this conversation. So I'd love to speak too. Would you be willing after a few sentences to sort of check in with what's coming up in me? And then we sort of go back and forth. Doesn't that land differently than, your problem is you talk too much, and then we avoid them. That's how most people handle those type of situations. I don't want to go out to dinner with them. They talk too much. And now there's disconnection, and it's a very uncomfortable place to be. So what do we have to do? We got to first be able to discern what our needs and values are. We then attach our feelings to our needs and values. Our feelings are not caused by other people. They're caused by our needs being met or not met. So if I have a need that's not met, I will feel unpleasant feelings. If I'm worried about a need not being met in the future, I will have unpleasant feelings. And if I have needs that are being met, I have very pleasant feelings. That's it. That's what feelings are. They are sensations in the body that encourage you to take action to try and meet a need. So if I'm standing too close to the edge of a cliff, my need for safety is not being met, and I will feel scared and anxious. And then if I take action, I will step back from the cliff, and then my fear and anxiety will go away because my need for safety is met. That's how all feelings work.
So would
So I
you,
want,
yeah, so
yeah.
would you be able to give an example? This is a beautiful example you said. So, okay, so let's say if you don't want to go to a dinner with a person thinking that that person talks too much. So here, as you have explained, like it's very important to see what our feelings are and if our needs are met. So what would be an example of the nonviolent communication here? So what reaction or what action from our part would maybe help
So if I
our
don't want to go to dinner, you're saying?
yeah.
Well, it depends. Am I trying to connect with that person about this, or am I just trying to not go to the dinner? I've already decided I don't want to go.
So let's say I do want to connect with this person, but I think
Yeah.
that this person talks too much.
Yeah, so you take it personally. So I would say something like, would first connect to myself. If I think that that person talks too much, it's disconnecting. But that's usually how we think, because that's how we were brought up.
Mhm.
So the first thing I do is, when I think this person talks too much, what's going on? So I'm doing self-connection first. That's why I close my eyes and I'm like, I'm feeling frustrated. I really want to be heard too. I want to know what I say matters. I want a collaborative, engaged conversation. I'm not here just to be a receptacle for other people's words. So that's why I feel frustrated. And my guess is when this other person talks, maybe now I'm trying to empathize with the other person in my head. When they talk like they do, maybe they're feeling really excited to share all this stuff. Or maybe they're nervous and they talk because they just fill up space because they're really uncomfortable. Or maybe they don't get to be heard much and they just are so excited somebody's listening to them.
Mm.
And they just want to be heard and they're really excited. So now when I start guessing what's going on in them without enemy images, they're trying to meet needs to be heard and self-expression and contribution to you and just excitement of connection. Okay, that makes sense. But the way they're meeting those needs is not working for me. So I'm going to come in and I'm going to say, okay, hey, John, I just want to let you know how much I enjoy connection. And sometimes when people use more words than I can take in, I start to get distracted or I'm not engaged. And I so want to be connected to you when you're talking. So I'm wondering if you'd be willing to do a couple of sentences and then ask me sort of what I heard so I can tell you what I'm hearing, and then it'll keep me engaged and really focused and present. How does that feel, John, when I ask you that? Because I don't want you to hear criticism. I want you to hear how much I love hanging out with you. And I just want to make it even more engaging for me. Does that feel like criticism to you, John? And then you check in. So I'm checking in about the connection after I just shared empathically my experience with care for them. Do you see how I did that?
Yes. Excellent. Yeah. Thank you for that example. Yeah.
Yeah. So then you see at the end, communication. So once I discern my needs and values, which I did, I attach my feelings to my needs. I'm not feeling that way because he talks too much. I'm feeling that way because I want to be heard. Then I align my behavior with my needs. Okay, I'm not going to just keep listening and suppress my needs just to be polite, which is how a lot of people were taught to be. I'm going to actually speak up, right? Because I'm not going to live in artificial harmony, just being a polite person, silently listening to someone talking at me when I'm not enjoying it. And it's really important to do that because you know how many times I do talks to groups of people and I say, if somebody is really bored by the amount of words you're using, would you prefer that they stop you and tell you, or would you like them just to keep listening politely, even though they're thinking how bored they are? And nobody ever says, keep listening and be politely bored. So people want to hear it, but they just want to know that you care too. And it's hard to hear if you express yourself as what they're doing is wrong and diagnosing them as talking too much. So it's not that they don't want to hear it. They just want care. That's what nonviolent communication does. Because if you don't tell them you're suppressing yourself, you're changing your physiology, it's not good for your health. So once you know what your needs are, you communicate in a way that enhances collaboration. That's where the nonviolent communication comes in. Really quickly, these are the steps of nonviolent communication. There's O, F, and R, observations. Making observations, not evaluations. So evaluating, hey, that patient is a drug seeker. So right away, it's disconnecting you from that person. Versus that person has asked me to increase their pain medication dose on each of their last 3 visits. So you see how an observation feels much more connecting? That's the point of an observation. There's some other points, but that's one of them. Feelings versus thoughts. You want to express your feelings, not thoughts. If I have a thought, it could be of what you're doing to me, versus feelings are just inside me. I could feel sad, I could feel hurt. But if I'm manipulated, excluded, or rejected, that requires somebody else to do it to me. Those are not feelings. Those are thoughts of what other people are doing to me, and they're very disconnecting. So when I feel worry, fear, happiness, all that stuff, that's feelings. They don't require anybody else. Needs, not strategies. A lot of people get into fights about strategies. Needs are universal, they're abstract, and everybody has them. We all have needs for love and care and safety and cleanliness and order and support and food and water. But we all have different strategies and priorities for meeting those needs. When we fight, we're fighting about strategies, not the needs. So if I say, hey, I want to go out and get food, and the other person says, I want to get food too. Oh, we both value food. You see how we're at the needs level, we're all good? Now, if I say, I want to go and get Italian food, and the other person says, I want to go get burgers, that's a strategy to meet your need for food. So now we could argue over that. But we're not going to argue about food. We both value food. But the one person might hate burgers and the other person hates Italian food. So the connection, right, and the same thing could be safety, right? We both value safety, but you want to meet your need for safety with the strategy of buying a gun in the house, and the other person wants to meet their need for safety by living in a house with 10 people because there's power in numbers. So both are trying to meet their needs for safety, but they have different strategies, and then they can argue about strategy. The last part is requests versus demands. That's very important. People don't want to hear demands, even if you say please. So when we tell kids, please pick your clothes up, and we really mean pick your clothes up now, they don't like it, and they can smell the demand from miles away. And they don't like demands dressed in request clothing. So it's very important that you know that a demand is when you can't hear a no. So somebody request invites collaboration and discussion. So it doesn't mean you're okay not getting your needs met, but it does mean you're willing to talk about and negotiate a way to care for everybody's needs. That's the difference. I care about my needs for order in the house. I care about your need that you're in the middle of a game and playing. I care about my need for trust that you're going to follow through with your agreements about picking up your clothes. And I also want to care for you that maybe it's harder for you to remember and we didn't come up with a strategy that makes it easy to remember. And I'd like to work together to figure out how we can meet my needs and still be caring for you. So you see how I'm trying to do both? Doesn't mean I'm okay with leaving the clothes on the floor either, but we're going to get to that. This is the 4 Ds of disconnection. Just from a time, I'm going to go a little bit quickly. So diagnosis, these are all disconnecting when you do the Ds. You want to transform your Ds. So remember I said when you say, the problem with you is that you talk too much. That's a diagnosis. Denial of responsibility is, hey, I'm sorry, I wish I could, but I can't. It's not up to me. I don't have choice. I'm the victim or I'm just going along. If you're the victim, right, people will say to me in my coaching sessions, oh, I'm stuck in this job. And I'll say, you're not stuck in this job. You're choosing to stay in this job because you can't think of another way to make the same amount of money. You're choosing to stay in this job because it's overwhelming to think about getting a new job, right? There's lots of reasons you're choosing to stay, which makes sense. But as soon as you connect to your choice and get out of the victim mentality, you shift your physiology because victims who are trapped go into threat physiology. People who are making choices and empowered, they are not in threat physiology. So it's very important for your health to not talk as if you were a victim. The demands we talked about, demands also are disconnecting. And then the deserves, she deserves to be punished. I deserve this because I never asked for anything, right? There's this sense of you have to do it. There's an expectation instead of connecting to the joy of life and the desire to contribute. So someone says, hey, I would love for you to contribute. Would you be willing? That feels great because then you can celebrate their contribution. If they're like, I just deserve this, now they feel like a demand. And if they don't do it, you're going to be really disappointed with them. And there's a consequence. The connection dance is basically going back and forth to these three steps of, remember, I empathized with myself. I wanted to know what was going on inside of me. Then I checked in with you. Hey, did you hear criticism? How was that for you? So that's the self-empathy and then empathy for the other person. I'm checking on our connection. It's almost like a triangle, the base of a triangle. And then when our connection is solid, that's when I had the point of the triangle, which is the honest expression. Hey, so would you, be willing to meet my need for ease of connection to say a couple of lines and then ask me what I heard so I can reflect that back and stay more engaged? That's the honest expression. But if I don't check on our connection, I don't know if he's ready for that honest expression or not. Then I make an honest expression, and then you saw how I checked on our connection again. Hey, what did you hear? How did that feel? And then I checked in with me. Maybe I'm feeling scared and nervous because he's got a face on it, and his face is flat. I'm like, oh, maybe he's angry, or maybe he's sad, or maybe he heard criticism. But let me check that out. So I'm checking in with me, I'm checking in with him, and then I'm doing honest expression. Then I check in with me, I check in with him. And that's the dance, right? It's like this triangle that we're going, triangle step. So what decreases inflammation, cancer, heart disease, Alzheimer's, viral infections, and other chronic disease? Transforming the 4Ds of disconnection, trying to observe instead of evaluate, feel instead of think, needs instead of strategies, requests instead of demands. Pretty simple, right? Saying I want to connect more isn't doable, but using that OFNR, the observation, feelings, needs, requests, translating the 4Ds and engaging in the connection dance, that is doable. So if you want to learn how to do these things and become proficient in these skills, not only does it make your relationships wonderful, it improves your physical health. Oops. So when you can see these or hear these comments from people and empathize with them, and your body doesn't tighten, or when it tightens, you immediately recognize the tightening and do some self-empathy. So if somebody says, you never listen to me, and I'm like, oh, how can they say that? Oh, I'm feeling defensive because I have a need to be seen differently, that I do value listening. And I wish that they wouldn't make a generalization. Maybe I didn't hear them in the way they would like now, but I just want to be seen that I do care about that. Okay. And then now I did my self-empathy. Now I'm going to empathize with them. Oh, are you wanting to be heard? Is this really mattering to you? Maybe you're feeling frustrated. Well, what can I do to help you feel heard? So if I can do that, I switch my physiology. And my relationship gets better. It's a win-win. Here, you can go to our website, weheal.health, and you can get this sheet of feelings and unpleasant and pleasant and the needs. Really practice that. We don't have time to do a role play. There's also the We Be Calm, which is helping the nervous system regulate. We've created this for kids because a lot of kids have dysregulated nervous systems, a lot of anxiety now. This forces them, it shows them how to take a slow breath, holds the ball up, and it trains their body to do something that we call the We Be breath. So you take this We Be Calm device and it trains their body to do that, to the point now where if they use it just at night, just to keep that maintenance, so they get to practice the muscle memory. At any point now, I can hold my bracelet up and just point, and their body, because they've done it so often every day using this tool, they know exactly what to do, and their body has this muscle memory of how to turn on calm very quickly. So it's a really fun little device. And then we have our book. If people want to read more about this, Wellness to Wonderful, and our 9 pillars for living healthier, longer, and with greater joy. Talked about our podcast, the We Be Parents podcast, about bringing MBC into the families. And then our website, webetogether.com, really bringing people together. It's about connection. It's about living your best life. And you can't do that unless you value nutrition, lifestyle, and connection. And that is everything. How'd I do? We're good on time. Nice.
Yes. Thank you so much. This was so powerful. And so Grace is asking, in the beginning, you mentioned about the pain, sciatic pain. So how long did it take for you to train yourself with the nonviolent communication? Or
When I started, I had 3 feelings. I had a feeling good, feeling bad, and feeling angry. So I had a lot of work to do. I was pretty disconnected from my heart, and that was basically keeping me in a chronic state of threat physiology. Plus, the way I worked with high intensity and how I communicated, how I thought, right? Because it's really important what you say, what you think, and what you do. And if you can transform what you say, think, and do, you're on the right track. But it takes a lot. It's like learning a new language.
Mhm.
So it took me, for my pain to go away, it was a month or 2, but it went away and hasn't come back. And it was there for 6 months. I was almost going to get surgery. That's how miserable I was.
Thanks for sharing, and that is so inspiring. So we have posted your website and the podcast links on the chat here. So like if people want to reach you, so what would be the best way? So I mean, just
Yeah.
go through your website or...
Yeah. I mean, it depends if they want to go to the website. It's weheal.health. It's not .com, it's .health. And they can find out about, working with us as clients, coaching clients. If they want to do the the podcast, that's webeparents.com. If they want the We Be Calm, they can see that at webecalm.com or We Be Together. So you'll find us, and just depends what you want. Our book is on Amazon. It really depends on what people are looking for, but our whole focus has been on bringing more connection and sort of making life more wonderful for people.
Thank you so much. So we have posted all the links so that people can see this. And this links would be also under this video. So I know like this is on the YouTube live. So all the links are available for people to reach out to you. And I really appreciate, thank you for the time that you have spent with us today, and people are loving. So we have wonderful comments here that this was the most amazing session, and people are really happy that you got to come here and share this with us. So thank you so much. I know like you have to go, so I will let you go. I won't hold you for long.
Well, thank you very much. I appreciate everybody listening and being open to this information. I think as we understand the science more and more, it's going to become more and more clear. But why wait? It's sort of like, we knew the plant-based diet was great, 20 plus years ago. Why wait until now to do it? It'll really, to me, for so many of our clients, it's the missing piece when they just can't get healthier and they don't know why. So it's really enlightening. So thank you for being open to this information. I really appreciate it.
Thank you so much.
Okay. Take care. Bye-bye.